The US is clearly in a surge. Even with cases undercounted and underreported, the CDC's delayed community-level maps are starting to turn red across the nation. Welcome to this week's weather report from the People's CDC for the week of May 30th. The CDC's community transmission map remains red across most of the US, with an astounding 96% of US residents at high or substantial transmission. While earlier mask mandates could have reduced cases, the CDC has yet to call for masking or any other precautions besides vaccines to protect the public. For the fifth week in a row, hospitalizations continue to increase nationally. While hospitalizations are still relatively low, this measure does not capture the risk of long COVID or other concerning health outcomes. In this year alone, we've had 3 successive subvariants of Omicron wash over the country. 2 more variants, BA4 and BA5, have been found, thanks to South African scientists. Early lab studies suggest that BA4 and BA5 can escape immunity from earlier strains like BA2. This means that folks who recently had COVID may be vulnerable again. In long COVID news, a new report by the CDC this week finds that approximately 1 in 5 adults will experience a new condition starting 1 month or longer after surviving COVID. COVID survivors have twice the risk for developing pulmonary embolism or respiratory conditions. Boosters are available for everyone 5 and up. The FDA will meet on June 15th to review vaccine data for children under 5. If they recommend authorization, young children could begin vaccination early this summer. In addition to vaccination, masking and ventilation, as well as paid sick leave and access to testing, are key to protecting ourselves and each other. Some universities, citing high COVID transmission, have reinstated indoor mask mandates, including the University of Hawaii, UCLA, and University of Delaware. We hope that others will be soon to follow. That's it for this week's weather report from the People's CDC.